parent need to be alert to say this could be the flu?
I think one of the earliest signs is your child just won't be as active and playful as they usually are. And then after that, you'd find that the temperature starts to rise, and then you'll see the other symptoms or signs like the runny nose and the sneezing and the cough that's coming on. But initially, I think it's more the lethargy, when your child is just not that active, or should I say hyperactive toddler that you're used to seeing run around your house and cause a bit of chaos all over the show.
Also, the school situation does create a bit of havoc here because it's often spread, among schools, or you could be going to a shopping mall, for example, or out and about. How concerned should parents be, especially in the flu season, when exposing their kids to larger groups?
The biggest problem would be the young ones that go to daycare centers and creche. Firstly, because they're very young, so they have more risk of the complications of influenza, which would be like pneumonia. And also because of sometimes, unfortunately, some of these daycare centers and creches are overcrowded, so there's a higher risk of spread of the viral infection. Those are the parents that need to be worried about their kids during these influenza seasons or any other viral outbreaks, whether it's measles or hand, foot, and mouth disease. Because when these viruses do the rounds, you see them most often in kids that go to daycare centers and creches. So it's the smaller ones, the younger ones. The older ones generally handle the symptoms better, and they fight off the infections much quicker than the very young.
Okay, so in terms of the flu and what is often called the common cold, could the flu initially present as the common cold?
Yeah, it's basically just a different virus. The common cold is caused by a different virus to the influenza virus. The flu is caused by influenza virus, and that's why for short we just call it flu, whereas the common cold is commonly called by a virus known as rhinovirus.
Right.
In terms of the symptoms, they're almost the same, but the flu can be a little more severe than the cold. Generally with the cold, you don't get such high temperatures as you would get with influenza. With influenza virus, I mean, these kids that we're seeing coming to us now, they come looking ill, they have this toxic appearance, they have the rigors, so they're shivering, they have temperatures going up to 40, the classic influenza picture.
In terms of self-medicating, some parents will have some knowledge of it thanks to Dr. Google or maybe past experiences in engaging with pediatricians or family physicians. Would you recommend, parents self-medicating their kids?
I think, in the majority of these cases, if your child is otherwise a healthy kid, you can control most of the symptoms with medication that you'll find in your cupboard. A simple syrup like paracetamol.
Right.
It helps to control the high temperature. It makes your child comfortable. It reduces the pain. This influenza virus causes muscle pain. It causes body pain. So it's good to make your child comfortable and to give a simple analgesic, something that's simple for pain and fever.
Right.
And paracetamol is a safe option, and it's effective. It works very well. So that's something that you most often will find in the cupboard at home. Any home that has kids has paracetamol syrup in there. Sure. That's a safe option. You can also relieve some of the symptoms of the cold, like the congestion and that, with a simple saline nasal spray. Because these kids, especially the smaller ones with the blocked noses, it makes their feeding difficult, it makes their breathing difficult, it makes their sleeping difficult. So they get restless, and then that makes the parents restless. So a simple saline decongestant for the nose, simple paracetamol syrup, usually does the trick. As long as your child is feeding well and you can maintain your child's hydration, that is the most important thing. What we shouldn't rush for is antibiotics. I think that's a very important take-home message. Influenza is a virus, and antibiotics plays no role in treating viral infections. We're also seeing big-time resistance now to antibiotics that we use, especially in sick people that really need it, like in an intensive care environment or in the hospital, where the antibiotics, you're getting these super bugs that are resistant to antibiotics. So to avoid those kind of situations, we shouldn't rush to treat these common viral infections with antibiotics. And parents need to know that it's not necessary to give your child an antibiotic in the majority of cases with influenza, unless there's a complication like a pneumonia where your child will develop, but it's not common. Maybe 5% of all the people with influenza will develop a pneumonia, and those are the ones that might require an antibiotic. That's when you need a doctor to actually come in and decide what the course of action should be. But the simple viral infections that you can manage at home with, like I told you, 2 simple remedies, they don't require antibiotics. And we shouldn't rush to treat every kid with a fever with an antibiotic.